In this video, you'll discover the top 10 paying healthcare careers that can pay well over $100,000 a year, some with far less schooling than medical school. Make sure you stay till the end of the video because the final career consistently ranks among the highest paying jobs in all of healthcare. Number 10. Dentists. You probably think of teeth cleanings and cavities, but dentistry is one of the most financially stable paths in all of healthcare. According to data compiled by the Bureau of Labor Statistics, general dentists earn well into six figures, and specialists like oral surgeons push far higher. The path takes 4 years of dental school after your undergraduate degree, plus licensing exams in your state. 4 years, that's it. No decade-long residency, just a clear, direct road to a six-figure income. Compare that to almost anything else on this list, and dentistry starts to look less like a compromise and more like a shortcut. You open your own practice, you set your own hours, you build equity in something you own, not just a paycheck you're handed every 2 weeks. And unlike most of the specialties further up this list, a dentist controls their own schedule almost entirely. No hospital administrator dictating call shifts, no emergency room paging them at 3 in the morning, just a practice, a patient list, and a set of hours they chose for themselves. Number 9, physical therapists. You've probably met one after an injury. What you didn't see was the doctoral degree behind their name. Most physical therapists today complete a Doctor of Physical Therapy program, and the top 10% in this field earn well over $130,000 a year. Those working in outpatient clinics and home health often earn even more. Why? Because an aging population needs more of them every single year. Every hip replaced, every knee reconstructed, every stroke survivor relearning how to walk needs someone standing beside them, counting reps, adjusting resistance, tracking progress week by week. That demand doesn't slow down, it compounds. Number 8, pharmacists. Here's something most people never realize. Pharmacists don't just count pills behind a counter. They complete a Doctor of Pharmacy degree, pass a national licensing exam, and in many states pursue board certification through organizations like the American Pharmacists Association. Median pay sits well above $130,000 a year, and the role keeps expanding into chronic disease management, vaccinations, and clinical consulting. The counter is just where you see them. It's not all they do. Behind that counter is someone who spent 4 years after their bachelor's degree learning drug interactions precise enough to catch a mistake a physician might miss. That knowledge is worth more than most people realize. The paycheck reflects it. Number 7, physician assistants. This is the profession most people confuse with a nurse, and that mistake costs them years of misunderstanding. A PA completes a master's degree, typically around 26 months of intense training, then sits for the PANCE exam administered by the National Commission on Certification of Physician Assistants. Pass that exam and you're diagnosing, treating, and prescribing, often with pay well past $100,000 a year starting out. Fewer years in school than a physician, similar responsibility in the room. Ask yourself something. Would you rather spend a decade in training for one specific ceiling, or 2 years for a career that lets you shift specialties later without starting over? For a lot of people, that flexibility is worth as much as the salary itself. And unlike most physicians, APA can move between specialties over the course of a career. Start in emergency medicine, shift into dermatology a few years later, try orthopedics after that. No second residency required, just a conversation with a new supervising physician and a willingness to learn. Number 6, nurse practitioners. Here's a fact that surprises almost everyone. The Bureau of Labor Statistics projects nurse practitioners to be among the fastest growing occupations in the entire country, with growth rates near 45% over the coming decade. Median pay sits above $129,000. The certification comes through boards like the American Association of Nurse Practitioners or the American Nurses Credentialing Center. You need a master's or doctoral nursing degree. That's the whole barrier to entry. On the other side of it, independence, autonomy, and a salary, most bachelor's degrees can't touch. In many states, nurse practitioners can now run their own practices without a supervising physician standing over their shoulder. That single legal shift changed the entire trajectory of the profession, and the salary numbers moved right along with it. Number 5, certified registered nurse anesthetists. Say that title slowly because it holds one of the best kept secrets in healthcare pay. A CRNA administers anesthesia, monitors patients through surgery, and earns a median salary north of $220,000 a year. The credential comes from the National Board of Certification and Recertification for Nurse Anesthetists, and the training path runs through a master's or doctoral nurse anesthesia program after years as a registered nurse. Shorter training than a physician, a paycheck that rivals one. Here's the twist most people never expect. A CRNA often earns more per year of training invested than almost any physician specialty on this list. Fewer years buried in school, a comparable number on the paycheck. That ratio is exactly why this role has quietly become one of the most competitive graduate programs to get into in all of healthcare. Number 4, psychiatrists. You already know this is a medical doctor. What you might not know is how fast the demand is climbing. The Bureau of Labor Statistics projects psychiatry's positions to grow faster than almost any other physician specialty, driven by a surge in mental health need across the country. Salaries frequently land well above $200,000, with many specialists earning considerably more. 4 years of medical school, 4 years of residency, then a door most people never even consider walking through. For decades, psychiatry sat near the bottom of physician pay rankings. Not anymore. As demand for mental health care outpaces the supply of providers, hospitals and health systems are raising compensation just to keep positions filled. The specialty that used to be overlooked is now one of the fastest rising paychecks in medicine. Number 3, cardiologists. Heart specialists sit near the very top of medicine's pay scale, with average salaries reported by physician compensation surveys landing well above $300,000 a year, and top earners well past that. The training is long: medical school, then a residency in internal medicine, then a cardiology fellowship on top of it. Years of your 20s and early 30s spent in hospitals while your friends start other careers, buy homes, and build families. But the ceiling on the other side is one of the highest in the profession, and heart disease isn't going anywhere. As long as it remains one of the leading causes of death, cardiology will remain one of the most in-demand and most compensated corners of medicine. Every stent placed, every bypass performed, every pacemaker implanted adds another patient to a waiting list that never seems to shrink. Hospitals compete hard to keep experienced cardiologists on staff, and that competition alone pushes compensation even higher. Number 2, orthopedic and other high-end surgeons. This is where the numbers start to feel unreal. Compensation data from physician surveys places some surgical specialties, including orthopedic surgery, well past $500,000 a year on average, with top earners in private practice going even higher. The training pipeline runs through medical school, then a surgical residency lasting 5 years or more, sometimes followed by a fellowship for an even narrower specialty. It's one of the longest roads in this entire list. It's also one of the most rewarded. Replace a hip, repair a torn ligament, rebuild a shattered bone well enough that a patient walks out and forgets it ever happened. That kind of precision, repeated thousands of times over a career, is exactly what the market is paying for. And now number 1, neurosurgeons. Here's the number that stops people mid-sentence. Compensation data reported through physician salary surveys places average neurosurgeon earnings above $700,000 a year, with some private practice surgeons crossing into 7 figures. Think about what that job actually involves. Operating on the brain and spine, zero margin for error, years of nights spent on call, because the human nervous system doesn't wait for business hours. The path to get there is brutal by any standard. 4 years of medical school, then a neurosurgical residency lasting 7 years, one of the longest of any medical specialty. Some surgeons add a fellowship on top of that for an even narrower focus, like pediatric neurosurgery or spinal surgery. By the time a neurosurgeon operates independently, they've often spent more than a decade in training after their undergraduate degree ended. Their late 20s and early 30s, the years most people spend building a career, buying a first home, or starting a family, are instead spent in operating rooms, memorizing the exact geography of the human nervous system down to the millimeter. So why does the pay reach that high? Supply and complexity. There are relatively few neurosurgeons compared to the demand for their skill, and the consequences of an error are about as high stakes as medicine gets. A single misplaced movement can mean the difference between a full recovery and permanent damage. The market pays accordingly because almost no one else on earth is qualified to do what they do. So if you're standing at the start of one of these paths, here's the real question to ask yourself. Not which job pays the most. Ask yourself how many years of training you're truly willing to commit to, and whether you can see yourself doing that job every single day. Because in healthcare, the paycheck was never really the finish line. It was the receipt for everything you paid before it.